that we present at the start of these briefings, what I was pointing out was that as we began to see reductions in the use of transport, indicating that the British public were beginning to comply with the guidance that had been issued on social distancing, that if that was sustained, then over time it would translate into a reduction in the number of cases, a reduction in the number of hospital admissions, and then finally through a reduction in the number of deaths. And of course, a number of weeks ago, those charts all showed that infections and hospital admissions, people in critical care, and deaths were on the increase. Over the last few weeks, of course, we have seen, because those social distances measures have been adhered to, that those curves have started to change. And as I showed you just a few minutes ago, we are now beginning to see declines, particularly in London. And yes, deaths are now either plateauing around the country or beginning to decline. But I should emphasise that those benefits have only occurred not by luck, as I've said before, but because people have complied with the instructions that we've all been given. And they have followed the science. So the science of this is quite straightforward. If we reduce the number of people that can be infected from an individual person who has the virus to below, on average, 1, then the virus starts to go into decline and the number of infections start to fall. That is the simple principle behind the measures of social distancing. And what you have seen is all our efforts, hard though they might be, have begun to pay off. But of course, the other point to make there, of course, is that it will only continue to pay off if we continue to keep social distancing and we continue to comply with those messages. Because, of course, my fear, as the fear of all of us is that those curves won't continue to be on a downward trend, but will start to go in an upward trend. And we're not at the point that any of us can be absolutely confident that that's not going to be the case. We want to avoid a second peak. We want to avoid a rise. And so I can't emphasize enough that this is not the time to say, actually, we've done a good job. We need to stop complying with our social distancing instructions and the government guidance. This is exactly the time to keep that up. It's exactly the time. And that's why when I showed you the transport graphs and curves earlier, that slight uptick in motor vehicles, that slight uptick in the use of Apple Maps, we need to keep a close eye on that. We all need to remind ourselves that this has been a really tough 4 weeks, and we don't want to lose the benefits that have come from this. We need to keep going, and we need to make sure the number of infections continues to decline.
Thank you very much. And finally, Jen Williams from the Manchester Evening News.
Hi, thank you. A question first for the Minister, if I may, and then one for both of you.